Hi, I'm Dr. Laura Summer, and I'm here to help show you how to do lunges, especially if you have knee pain due to arthritis. So what we're going to start with is a lateral lunge, where we're actually not lunging, we're actually doing this statically. So what Sam's going to do, she's going to bring her feet about a little bit more than hip width distance apart, and we're going to start weight shifting into one leg. So her right leg is going to stay straight, her left knee and hip are going to bend. So we're thinking of moving the hip first, pushing that back. Good. Shifting our weight onto that left leg and then pushing through our heel to have us stand up again. Okay. If you need a little bit of help, we can use this, holding on to start and then eventually doing this without your arms and then adding a weight. To then progress that exercise, we're going to start with our feet together. Okay. And we're actually going to step into that lateral lunge now. So feet are together. We take a nice step out to the side, pushing our hips back, coming back together. So we're working on getting some of that impact into our leg again. Okay, working on our balance, figuring out where our body is in space and trying to step to the same spot every time we do it. So now what we're going to do is we're going to progress that movement to an actual front lunge type of position. So this is a static split squat because our feet aren't moving. We're keeping our feet where they are. We're just going to move our body up and down. So we can use our arms to help us to get started. We're going to drive through our front heel. So we're pushing the ground away with our front heel and then slowly lowering down. Again, what we can do as we get better with this exercise is starting to increase the range of motion of how far we're going down towards the floor. So once you're able to do split squats without using your arms and using a weight, now we're going to try lunges. So this is when our feet are actually leaving the ground. We're going to step our foot forward, lower our body down slow and controlled, and then push ourselves back up to the starting position. So Sam's going to do a few facing this way just so you can see from the side. She's keeping her shoulders and her hips in a nice straight line. Okay, she's not leaning too far forward, too far back. And then if she's facing you, after she finishes the repetition, so she's going to face you, you can see where her knee position is. So as she steps forward, her knees aren't caving in. She's not wobbling all over the place. This is working on your balance. So especially if you're new to this exercise, you might need to hold on to start. And again, this is an exercise that we eventually want to be able to build up to doing with a weight. So if you find that doing a front lunge is a little bit too much on your knees, what you can always do is actually do a backwards lunge. So taking a step back will force you into your hips a little bit more, which are obviously your bigger muscles, and it will help you keep a better alignment with your knee and hopefully reduce some of that knee discomfort you're feeling when you're doing this exercise. So as always, make sure you reach out to your doctor, your physical therapist, or your personal trainer. So make sure you're doing these exercises correctly and not hurting yourself. And if you need personalized guidance and you're in the Farmingdale, New York area, reach out to our office today and we'd be more than happy to help guide you.